For more, we can talk to Alison Pollock. She's a professor of public health at Newcastle University. Thanks for joining us today on the programme. First of all, you heard the Nepal variant being mentioned there. That's currently not being investigated by Public Health England. So how worried should people be about it?
Well, we don't know. We do know that viruses mutate and variants occur, and their significance is unknown. And the WHO has certainly not made any statements about this variant at all. So the real issue is what's really happening in the real world. And in the real world in the UK, people are out and about mixing. We've got some restrictions in place, but not very many. And we've got a lot more mixing going on. And the good news is that overall deaths from COVID are right down, almost zero. And the overall death rate is number of deaths for this time of year is well below the 5-year national average. So this is really good news. And on top of that, we're seeing very few hospital admissions, very, very few. It's about 1 per 100,000. So really what we're seeing is a lot of perhaps little local outbreaks, but the data are very difficult to interpret because people are being tested who are asymptomatic, and a test is not a test of infectiousness, so we don't know really what a case is. So we've got a mixture of things going on. We've got people who are being tested who have been vaccinated. We've got people who are being tested who may have old infection. We've got lateral flow tests. We've got a really confusing picture around the cases as well.
Dr. Pollock, if I may just cut in there, it seems like you're painting a picture of a United Kingdom that's actually, coronavirus-wise, not in that bad a position. As you said, hospitalisations are dropping, the death rate rather, is dropping as well. So do you think the UK government is perhaps being a bit overcautious here by effectively banning international travel this summer?
Well, I think this is a real question. I think we're into geopolitics more than public health at the moment, because, the evidence is that things are looking very good. We've got very high vaccination rates. We're increasing increasing number of people who've had the second vaccine as well. And we've got good evidence of vaccine efficacy against all these different variants at the moment. So it's not quite clear what's actually going on. There's a lot going on the social media. The debate is becoming increasingly political and polarized. It's not helpful at all. And we seem to have lost some of the essentials of public health, which is around local outbreaks need local communicable disease control. They need to be publicly managed through public agencies. And actually, we have to stop getting so alarmed about all these variants. They're very interesting. It's very interesting science. But actually, everybody is becoming an expert on COVID. And this is there's a lot of contamination going on. And we're not getting the real public health analysis, which is coming through, which is we just need to look at the data carefully and responsibly, and not generate too much hysteria and too much panic.
Well, Dr. Pollock, I hear absolutely what you're saying there, but let me ask you about the situation in British schools. There was a new report published again by Public Health England yesterday. They point out that there are increasing clusters of cases of this Delta variant, that's the one first identified in India, in schools. Should the United Kingdom now be focusing on vaccinating children?
The risk-benefit ratio is not yet in favour of vaccinating children. Children are very low risk. In fact, COVID is a very mild infection, if any infection in young children. There's no evidence of long COVID harms apart from a very small number of cases. So really, this is the one disease that actually children can afford to get. And, we need to look further down the line when this is a new virus, which has been devastating, but will be very much like other cold viruses in a year or 2 years' time. That's what we're going to be predicting. So, the key thing is to vaccinate the people who really need to be vaccinated, which is older people. We have to think about vaccine equity. And really, it's absolutely there is no case at the moment for vaccinating children. The risk-benefit ratio doesn't support it.
Okay, that's really interesting, Dr. Pollock. Forgive me for cutting across at you. We don't have much time. Just finally, you talk about vaccine inequity there. The UK government has said they are preparing to start vaccinating teenagers. But are you suggesting that actually, instead of doing that, those vaccines allocated for children should be dispatched to other countries where there's a far greater need?
Absolutely, absolutely. There is not a case for this is monstrous that we're thinking about vaccinating children and young people when we don't know about the long-term harms 20 or 30 years down the road. We don't have the studies. It's an emergency use authorization. And if anything, these vaccinations should be going internationally. Absolutely.